Sir, with your permission, sir, I'll start, sir.
Yes, fine.
Yes, sir. So, good evening, all. I welcome all you all to this webinar of the month series, and this is the 5th program we are conducting. And I welcome the dignitaries today. I welcome our President, Dr. V. George Reddy, sir, President, IPS Telangana State Branch. I welcome Dr. Minas, sir, President-elect, IPS Telangana State Branch. And I welcome today's chairpersons, Dr. Gauri Devi Madam and Dr. Anita Madam. And today's speaker, Dr. TSS Rao, sir. I welcome you, sir. I welcome Dr. Sai Krishna, Editor, Telangana State Branch. And I welcome Dr. Vishal, Direct Council Member and the Chair of Mental Health Awareness Committee, IPS Telangana State Branch. Now I hand over the proceedings to our President, sir. Sir, George Reddy, sir, please take over, sir.
Thank you, Pawan. Good evening, respected and dear all. At the outset, this is our 6th webinar of the month after this tenure of 2022-2023, and it was a fortunate moment for us to have thought of a topic. Particularly, we have been doing so many themes, and somewhere we thought of looking at sexuality, because that's one area I think psychiatry itself has a lot of stigma, and the sexuality concerned issues is further stigmatizing. So we thought we should definitely have a talk on a webinar on this. I think when we psychiatrists look at sexuality as a topic, and it is for sure we will not have anybody else in our mind as a speaker, and that's how effective our speaker is. And immediately called up Dr. TSS Rao, sir, and he immediately accepted, because that is the kind of bonding he has with our Telangana members. Not only Telangana members, he has so much bonding with all over the country. He has worked for the IPS in various positions, and definitely we thought looking at sexuality again from a female perspective, again not commonly touched, and it is in fact I would say it is neglected also. So for us psychiatrists and psychologists, it is an important topic, because we really have to help our patients, because they may not open up. And the speaker here today, Dr. TSS Rao, sir, is going to give the topic without taking much time. Then again, looking at the chairpersons, again, first person who would come into our mind is Dr. Gauri Devi Madam. And thank you, Madam. I think just Madam readily accepted to be the chairperson. Madam needs no introduction, and she has taken up various posts. She has been president at various level, at AP level, at South Zone level. Madam was retired as the Superintendent of Institute of Mental Health. She has been at a pioneer in child psychiatry. She has been motivating so many people. I think I was one among them. Her passion towards child psychiatry and general psychiatry, again, she's one person I think who all our lady colleagues should take as a role model, because I never see her taking rest. Though she says she has arthritis, but she never takes rest. She's always online or anywhere she's available. Thank you, Madam. And second, we have Dr. Anita Rairala. Anita is the professor in psychiatry at Institute of Mental Health, Eragada. She's my colleague. I think Anita was an active member of the IPS Telangana State Branch. She was the first EC member in the inception of the Telangana State Branch, and she has always readily accepts to take any position, a task given to her, and a wonderful clinician. And she's an asset to the Institute of Mental Health, and she also is following the footsteps of Dr. Gauri Devi, and we hope to see her in higher heights. Anita, thank you for joining us. I think nothing can be better than this CV for you. Though you have so many presentations, you have got so many award medals. But sure, Anita, Thank you for accepting the invitation. Yeah. With this introduction, I think I'll not take much time. I'll hand over the proceeding to Dr. Gauri Devi Madam and Dr. Anita Raira.
Yeah, good evening, everybody. Dear George Reddy and Pavan Kumar, Minaz, Vishal, and Anita, and Kishan. It's nice to be with all of you, at least online, if I'm not able to meet you together. And thank you for giving me this opportunity to chair the session. And especially with the TSSR as speaker, who was my class fellow almost 40 years ago, and Anita, my student. So I think I would say it's a privilege and I'm very happy about it. Today's topic, understanding female sexuality and the sexual dysfunction and management. I would say the topic is very, very important for all men and women. It's not only for psychiatrists. The reason why I say that, because people know about sex, they hear about the word sex, which they they consider it as sexual act or gender. People don't know that it's part of sexuality. And many people don't know anything about sexuality. I would say like a girl or a boy who reaches puberty doesn't know what is sexuality. He just knows something about sex. And people, I mean, you will be surprised when I say that people who got married in our own medical profession, the marriage was not consummated, they came to me. And people who gave birth to the children, I mean, they also don't know much about sexuality. So they only know about sex and the consequences. So that way, sexuality, especially female sexuality, is very, very important. So the terms, I'm sure Rao is going to talk to us about what is sex and what is sexual activity, and then what is sexuality, and then sexual health. The reason why I'm saying is that sexuality is a very, very vast topic which has sex as a component, and sexual identity, roles, orientation, and eroticism, pleasure, and sexual activity, reproduction, everything, whatnot. So, but only thing is female sexuality, as George Reddy said, women, I mean, they're not given really importance. When you look at the whole religious, or when you look at all ethnic or any culture, the sexuality means mostly they talk about male sexuality, and the female sexuality is, subordinate. And I still remember, like whenever we say, like, you are getting married, your daughter getting married. So did you have some consultation with the psychologist or somebody? And no, I told my daughter, just do what your husband does, So that is what you call female sexuality. Most of the places, even now, I would say, when people come to me with the sexual problems, it is that they don't know anything about sexuality. And coming to sexual health, that also most people don't know that. I mean, they need to know about their personal hygiene, what do's and don'ts, what are the attitudes, and like what they need to do for themselves, their body, and all the things, and reproductive health. A lot of people don't know about it. At least thanks to the feminism, and in 1970s and 80s, at least the women started fighting for the rights of women. As part of it, I would say the sexuality, female sexuality, has been elaborated. In the sense, they started talking about their preferences and the sexual health, the rights in the sexual health, and reproduction freedom, and all these things came into highlight. At least women have some point to raise and say that, I mean, we need to look after our mental health, our sexual health, the whole thing. So that way, I would say the female sexuality has widened to the extent that even legal recourse is happening. In the sense, previously, women, whether she's interested or not, she has to have sex. At least people are raising the issues of marital rape. People are talking about, women battering in the sexual area. All those areas, that means it all talks about the female sexuality. And having said that, we know that just like man and women, if unless there is a coordination between their body language, their emotions, their interactions, they cannot have normal sexual or peaceful sexual relationship and peaceful sexual health. So this is where I personally feel all the psychiatrists should have knowledge about the sexuality, both male and female sexuality, how they need to coordinate their efforts, both physiologically, emotionally, psychologically, which we do it in sex therapy. So these are the things I think all students and psychiatrists and physicians should have knowledge about it. Before I end my introduction, I just want to raise one very important topic to TSSRO. The reason is that of late we have seen, previously we used to be too traditional and the parents are still traditional. The girls and boys, they have access to the internet, they have knowledge about sex. Maybe they not know about sexuality, but the thing is with the knowledge and misinterpretation of things, they are getting into sexual relationships, and they're getting into problems of pregnancy and the relationship failures, attempted suicides. So these people, they don't have knowledge right from younger days what is really life and what is really sexuality. That way, I personally feel, I think we psychiatrists, we need to go out of our chambers and see that we talk to the parents. We need to tell them the elaboration of what is sexuality and what needs to be done to their children. Similarly, youngsters, because of their maturity, they do make mistakes and they need to be taught in a very secure way and scientific way what is sexuality and the mistakes they should not do, and what legally, ethically, and to some extent religious aspects also they need to keep into consideration in their sexuality. So that really prevents them doing mistakes and getting into problems. So with this brief introduction, I would say that TSSR is the only person who can talk about sexuality and mostly about female sexuality without any hesitation, because most people hesitate to talk about it. So that way I request TSSR talk to about the topic, and I request Anita, my co-chair, to give introduction about Rao.
Yeah, thank you, ma'am. Firstly, I would like to thank the IPS TSB for organizing this program and also giving me a privilege of co-chairing along with Dr. Gauri Devi madam. And she's my teacher, mentor and guide. And I thank Dr. George Reddy for giving me this opportunity, and Dr. Kishan sir, Dr. Pavan and Dr. Minaz also, I extend my thanks to them. And coming to the interesting part, I would like to introduce the current speaker, Dr. TSS Rao. He's a professor, Department of Psychiatry in JSS Medical College, Mysore. He was immediate past General Secretary of Indian Psychiatric Society, and he's editor of Indian Journal of Psychosexual Health. And he was formerly president, Indian Association of Geriatric Mental Health, and former editor of Indian Journal of Psychiatry from 2004. And he served continuously for 10 years from 2007 to 2018. And he is a co-chair of Psychiatry and Human Sexuality section of World Psychiatric Association. He's an editor, chairman, the publications committee of SASSM, and he has 344 publications to his credit. And he wrote many books and also chapters, and he won many awards and orations, including the famous Marfatia Award. And he is president of Karnataka Sexual Science Academy. Sir, we invite you for the topic, sir. And I request all the members to please send their queries to the chat box so that at the end of the session, we can take up some questions. Thank you.
I start sharing the screen.
Yes.
Okay. Able to see?
Yeah.
Okay. Full screen.
Slide share, sir.
Okay.
Full screen, sir.
Okay. Just a minute. Going to reduce this window. Where's that cursor? Okay. At the outset, let me thank Telangana State Branch of Indian Psychiatric Society. George Reddy is a man made for this particular program. One thing is thought of it. Second one, in that brief introduction, he mentioned so many things about positions and all of that. At least about 3 times he repeated. Thank you so much, George. My association with both Telangana and Andhra Pradesh has been a pretty long one, and I have, for all practical purposes, more friends in that particular these 2 states than anywhere else. And all the love and affection I have received is something phenomenal, and I am really grateful for that particular aspect. There are so many people there, starting from Kishan to Vishal and others, and we run a program called Fellowship in Psychosexual Medicine. Last year, almost about 1/3 of the people were from either Telangana and Andhra Pradesh. This time we have 35 people, and of which at least about 10 belong to this particular place. What it only shows is that there is a significant interest and what we basically call to understand and know certain aspects. George Reddy very specifically mentioned about such an amount of inhibition is there related to sexuality. And this particular inhibition becomes double or triple when you try to talk about female sexuality. That means this is one of the most neglected area. And we thought from that particular angle, this should be our point of discussion. This is one. Second one, if I just take some specific conditions and how I actually manage, it would literally make female sexuality something like purely mechanical way of presenting it. So from that particular angle, I thought some basic information is necessary for everybody to understand why actually, what actually works with men, it doesn't work with women. And when we are trying to talk about managing female dysfunctions, the whole aspect is based on what we basically call intimacy, trust, relationship, and those type of things. And for that particular reason, if you try to look at, I'm going to talk about it a little while later in greater detail, physiology almost same, nervous system is same, anatomy, maybe for the functionality wise, there is a slight difference, but all said and done, there is a wide difference between how actually the female functioning happens compared to the male system. So this is actually the focus. I am also able to understand that in next 1 hour, maybe 45 minutes, it may not be possible to make it everything understandable. Certain questions will definitely crop up, and I would be more than happy to do that particular job. I'll go a little slowly for the simple reason that, say, for example, in case of men, we talk about premature ejaculation. One of the most common problem is women are the most dissatisfied with that particular aspect. So when you are trying to talk about female sexuality, going a little slowly and understanding the concepts would be one of the better jobs to be done than actually hurrying up and running through. When we are trying to talk about female sexuality, almost always we get into the difficulty. I'm trying to reduce this particular window. Cursor, I am not able to get. Okay.
Anil, can you guide, sir?
No. There is a cursor supposed to be to reduce this frame. That cursor is not coming up. There's some problem. Okay, no problem.
Sir,
Anybody may ask me the question that, see, Dr. Gauri Devi is there. In fact, Gauri Devi was my classmate, and we were 16 people, 15 boys and 1 girl. It only shows how strong she was and how she managed all these 15 people, keeping at a distance and running the show. She was the queen of our batch. And Anita, I'm really happy because at one particular time, she was discussing very closely with how actually this particular branch can be developed. So the question here is actually, as a man, whether I will be doing the justice to this particular program. This confusion I too had, that I will, of course, I belong to the opposite sex, biased as a husband, father, son. I have one daughter who is psychiatrist, but psychiatry and sexuality, in fact, that may be one of the reasons why, in fact, I can talk about it. And I try to be as funny as possible. And one aspect is actually this gender aspect. The women are something extraordinary, and to know them, understand them, and how actually this particular aspects can be implemented. This is a learning process, and this particular opportunity, I treat it as actually for me to learn a lot of things, because so many people are there in this particular whole group. A woman is the greatest phenomenon, most beautiful creature of the God, and this particular aspect is actually very well emphasized. 1 minute. I'm just trying to remove this particular, which is blocking the window. Is all right? Okay.
It's visible, sir.
Visible, na? Okay.
Yes,
I'll just
yes.
run that way. I was trying to see this particular thing which is there, whether I can remove it. So it all depends on how and who is actually trying to look at it. Many of the times the problem happened mainly because understanding female psychology, understanding female sexuality, each of these aspects are something really different. I always believe that the females are the ones who are actually running the whole show, in the sense that world is running because of them. Men, in fact, their brain works in a quite a different fashion, and some meaning and some order and some worthwhile this thing to be brought about. This female issue is actually something extremely important. This is one of the Newsweek cover page. The Science of Women's Sexuality talks about searching for a female Viagra. Is it a mind or body problem? This particular article came sometime after this introduction of sildenafil citrate, at which time everybody believed that if man is able to get the erection, all female problems are solved. I still remember about 2 years later, around 2,000 plus women study from China documented that hardly anything has changed at all. This was actually a little surprising. And that's where actually people started again looking at it, what is actually that is missing and what need to be done. So what I will be trying to do is actually a little bird's eye view of certain concepts involved in this whole process and try to make some sense out of it. One is, if you look at, there are sexual differences we speak about. Arousal and orgasm. See, for example, orgasm, the time duration for both men and women is actually almost the same. But to reach that particular point, women take much longer time. So if I am just comparing from Mysore to Bangalore, we have to go. In fact, man can go almost very fast, like Super Deluxe bus runs very fast express. But women is saying it is actually another one small vehicle which is going on at a particular speed. Both reach, but there is a little difference. There are multiple aspects related to the fetishes, use of pornography, sex, feeling bored with this thing with the partner, female passivity, sex drive, behavior. Each of these aspects, very briefly, I will touch upon, for the simple reason that this is one of the key important component necessary for understanding why and actually what we can do as far as the management is concerned. This diagram speaks about at any given particular age. In fact, what actually people have documented is the woman's libido, or in fact, the sexual interest and other related things, there is almost always a little deficiency compared to the man at that particular age. Of course, one particular single point, I was told that there are a lot of psychologists and others are also there in this program. And this is one of the reasons, one of the best combination for marriage is, culturally speaking, we all believe that women should be young. This is what has been told in Anagaranga, that she has to be 16 years old. Then only she will be sensual. You have sex with a married woman or adult woman. In fact, you may not enjoy that much, and a whole lot of things. And we get do letter from some of the people. I am in love with a girl and I came to know that she's 2 years older to me. What shall I do? One of the best combination is actually a woman 2 to 4 years older than man. That's where actually the balance for what we basically call the
My ever-loving wife. During the last year, I have attempted to make To my ever-loving wife. During the last year, I have attempted to make love to you 365 times. I succeeded 36 times. This averages once every 10 days. And the following is a list of reasons why I did not succeed. It's too hot, 15 times. It's too cold, 3 times. I'm too tired, 19 times. It's too late, 16 times. It's too early, 9 times. Pretending to sleep, 35 times. I'm not in the mood, 21 times. Mind my hair, 28 times. Is that all you think about? 83 times.
Just to bring to the focus that men and women have a lot of complaints for the simple reason that so there is a significant difference between what we basically call male sexual drive and female sexual drive. Male sexual drive dependent on testosterone, and because of which, see what we call the pleasure and activity, both are linked, and actually it acts like a positive reinforcement and the activity is continued without significant dysfunction. This is one of the reasons why men want more sex, have more partners, have more sexual dysfunctions as they age. If you try to look at women, in fact, from the beginning, in fact, very classically, Dr. Gauri Devi brought into the focus the issues that females are almost always discouraged from thinking and acting anything related to the sexual. Intercourse and intense pleasure are not linked. For many, it is difficult to achieve orgasm. Less sexual frustration and a whole lot of emphasis on sentimentality and romance. Traditional societies discourage anything related to the sex. For them, it is more a duty than joyous and pleasurable thing. And over and above, the influence of hormones makes one whole lot of differences actually as far as the life is concerned. And this may be one of the reasons why desire for sex more often linked to relationship status than social norms. At all ages, women are more likely to report sexual dysfunctions. These are actually few of the conclusions of many of the studies which are actually available. Men get bored very fast. In fact, this may be one of the reasons why the promiscuity strategy and the excitement with what we basically call the variety, the novelty, and lot many other things. And men invariably is actually seeking that. The Coolidge effect, that one simple small story wherein the 30th president of USA, the madam's party was in the front and they come near a barn, and the barn manager says, as far as this particular rooster is concerned, he can have sex with 100 chicks per day. Madam says, you tell this to the president. And when president's entourage comes there, in fact, when they tell, the president asks only one question. Can you tell me whether this rooster has sex only with the same chick or with a different chick? So this is actually the whole difference what we talk about. So there is only one perfect wife in the world and every neighbor has it. In fact, these are the sort of very common themes when actually what we see. And I just picked up 1 or 2 diagrams to bring to the focus. See, men actually feel very liberal, exposing, and all these type of things are extremely common. And this particular picture is significantly indicator of how the female sexuality works. It is almost under lock and key. The nature has designed such a way that a lot of problems have been given to the females. And one of the explanations, say if you try to look at the female is the stronger sex, biologically, psychologically, socially speaking. And when we are trying to talk about natural pregnancy, almost 70% of it is the female baby. Natural abortions, it is about 70% of the time, it is actually the male, and emotionality and lot many other things, and they live for a much longer time, and many other such things have been spoken. But the difficulty is the menstruation, pregnancy, and lot many other things, actually the caring what she need to do. This is actually the biology that has impinged upon. This is one of the very typical story of actually how the woman, almost always, whether you are trying to talk about a model or you're talking about an ordinary person, that it is under lock and key. This is one of the very important messages I just wanted to convey. And this point is extremely important for the management. I'll come to that 1 minute, a few minutes later. Erogenous zones. See, when you try to look at man, all erectogenic tissues are concentrated on one particular place. You have a drug which acts at corpora cavernosa, and it can take care of a lot of things. You can bring erection, and for that, in fact, a little bit of fantasy and a little bit of stimulation that is what actually necessary. Anything female alive is more than sufficient actually for the man to get aroused. But you look at the female, all erogenous tissues are distributed far and wide, and this is one of the reasons why, unless she focuses, it is actually.
लड़कियों का प्लेजर पॉइंट कहाँ पड़ेगा? घीस पर जाने का है ना? मैं बता दूं। यहाँ से बिल्कुल सीधा जा, इधर ही है। सीधा आएगा अपना वजीना नगर पे टोल आएगा। उधर ऐसे अपना पर्सनालिटी, कंसेंट, डेट लेने का। उसके बाद आएगा छोटा लाबिया गेट। वहाँ पे बहुत संभाल के चलाने का है, बहुत शुक्रिया। फिर फैलोपियन फ्लाईओवर अपने आगे ना, तू बहुत आगे निकल गया है। तो वहीं पे गाड़ी घुमा के थोड़ा ऊपर नीचे, आगे पीछे, that spot right there, keep it going, yes, oh yes. मतलब फिर बारिश होगी तो समझ पहुंच गया।
तो वजीना नगर से स्ट्रेट।
बस ये लड़कों का प्लेजर पॉइंट कहाँ पड़ेगा?
मैडम यहाँ से सीधा जाने का एक बिल्डिंग पड़ेगा, एक ही बिल्डिंग, बुर्ज खलीफा टाइप।
बिल्डिंग से कहाँ?
कहीं नहीं, उधर ही, आसपास कहीं भी, कुछ करने का भी नहीं, सिर्फ सोचो, फुल घनाघन।
बिल्डिंग।
So there is a wide difference between men and women. The second point, in fact, I was talking about erogenous zones are distributed far and wide. And many of the times you might have noticed any romantic situation, women close their eyes. And why this happens, in fact, if you try to look at the whole physiology, and men keep their eyes open, what happens precisely is, all this erectogenic tissue, even at the genital level, it is distributed far and wide. Unless a woman concentrates, it is not possible for her to get aroused. So this may be one of the reasons why, in fact, any distraction can actually affect her in a very significant way. What I am trying to say is, at the peak of arousal also, a woman would be worried about whether a curd is set or the boy's bag for the school is ready or not. These type of things actually can interfere, and this is what actually the Bassen's, in fact, the circular model talks later. Of course, men keep their eyes wide open for various reasons, because who is coming next? In fact, that is actually their whole issue. Brain mechanisms. In fact, this is extremely important for us to understand, because without this particular knowledge, we won't be able to do a better job as far as the female sexuality is concerned. See, the men's brain is actually a little bigger, but in fact, I always say it is full of garbage, and it is like a desktop, low capacity, but wrong connections, and predominantly, it is actually preoccupied with anything sex all the time. But when you are trying to talk about female brain, smaller in size, but bigger capacity and very well connected. And this may be the reason why women really have smaller brains, but they use them better than men, what actually precisely they say. The reason why you are poor is because you think of sex when it rains instead of forming, is one of the very frequently made complaint from the females, and very documented consistently. And you look at the male brain. See, for example, sexual pursuit, territorial defense, alarm system, amygdala, what we talk about, the motivation center, pain circuitry and pleasure and other related circuitry, they are all very strongly developed in case of males. You look at the same male diagram, there are a few things like, in fact, I won't go into too many details. The temporal, or what we call as the cognitive empathy, emotional empathy, these are the things very significantly very low in development. in our therapy, many women come and tell us that, in fact, whatever I say, he doesn't understand. My words doesn't carry any meaning for him. My silence, he doesn't understand. Women, I'll almost always say that if you have your birthday coming tomorrow or day after tomorrow, you tell him that it is your birthday. You want one Kanjivaram silk saree, you must tell him that this is what I want. People or men can understand and he will react in that particular fashion. He is actually expecting too much from the male brain. Added to this worry ward and inhibitory system, what we talk about in case of female, which is very strongly developed. It is not that well developed in case of males. And you look at the female brain. Queen of emotions, the prefrontal cortex, and this is one of the things highly inhibitory as far as the sexual functionality is concerned. Gut feelings. In fact, they can interpret things much more better fashion, and the whole environmental interpretation is actually much better with females. Hormonal symphony and nurturing and to lot many other behavioral patterns, and these are all extremely common. Anybody married will be understanding that his wife, sometimes she is like wife, sometimes like his girlfriend, sometimes like mother-in-law, sometimes like mother. All the phases actually she will go through. What we basically call amygdaloid related things, so well developed in case of man, not that well developed. And this mummy brain, the milk production, nurturing behavior, these are all very well developed. More than anything is what we call as the worry ward. Anything, and more particularly in our culture, anything thinking about, say for example, for a man to close eyes and think of so many interesting things is very easy. For a woman to get aroused because anything other than her husband, to think about it, fantasize, she feels is an. And this is one of the reasons why, in fact, so much of time would be spent in actually starting from puja to 100 other rituals actually like. So they are actually, in fact, the fear of punishment, performance anxiety, and many of these type of things are very high as far as women are concerned. They never forget. Fight, romantic encounter. These are all actually, of course, both men and women, this can happen. But more than anything else, what actually has been found is they don't forget. They don't allow you to forget us. In fact, I can tell any number of stories. And one of the friend who had actually brought one muhurtam saree, which was of not good quality. He was narrating about his wife, telling about it 6 months later, 3 years later, 10 years later. And sometime back when she gave off all the sarees to the ashram, when he opened the almirah, this particular saree is still there. When he asked his wife, the comment made was, it is to remind you. What it means is, in fact, some of these type of things are emotional related aspects are carried forward for a long time and in a big way among the females. There are few male issues which actually women will find it very difficult. And this particular point you have to remember, because when you are trying to talk about female sexuality, apart from individual problems, wherein, say, for example, inhibitory female sexuality, training the woman in understanding her body, masturbation, and things like that is actually one of the procedures. I'll come later. But many of the issues are how actually the man behaves. What I am trying to convey, there is a significant emotionality which actually men actually find it very difficult actually to carry on. Men actually can't express emotions. This is one of the very typical story. And many women actually feel, in fact, he doesn't share anything with me. He doesn't express feelings. He's a total feelingless fellow. In fact, these are all extremely common complaint. One more other thing is actually, in fact, he doesn't listen to me, whatever I say. But I always say, see, men are deficit in almost about 25 to 30% as far as hearing ability is concerned compared to the female gender. So this particular difference can make in a very big way actually the whole lot of difficulty. What it means is, when a woman says about 10 things, he might have heard properly only about 2 or 3 items. Even that too, in fact, you may forget if something else happens and something sensual and lot many other things actually can impinge upon his this thing, capacity. Many men believe that sex means it is actually, in fact, that means the terminology, why the terminology screwing came, nut and bolt phenomenon like that. Purely physical in that particular sense, actually, they try to look at. But female sexuality is much more than that. The inhibited female drive, the hormones and its influence, in fact, people have documented in a very significant way a lot of things. Oh, what has happened? Okay. There are plenty of hormones are involved. Okay, there is some order by which actually we have gone, it has gone a little, right? Say something like estrogen, serotonin, pheromones, oxytocin, PEA, progesterone. These are the hormones which actually dominate the whole picture. Add to this actually the prolactin, the hormone of nursing. Compared to that, in case of male, it is actually the testosterone and what we call dopamine and related things, which makes so much of difference between why and how actually this man and woman actually, they differ in a significant fashion. Vasopressin and certain other of these type of things, again, very predominant role in case of females. And this actually leads to another situation wherein for the men, it is sex first and love next. And for the woman, the story is love first and sex next. And currently, say maybe about 3 decades ago when I was reading book, hardly we were speaking about this particular hormone called oxytocin. But now we talk about it mainly because when you are trying to talk about female sexuality, female orgasm, this is one of the most important points. And testosterone, very positive role, progesterone in some particular way, estrogen, the permissive, but both estrogen and progesterone, to a great extent, though even it is called as though active hormones, but all said and done, the female sexuality passivity is one of the very dominant role it actually plays. And what we talk about oxytocin, it facilitates attraction and touch sensation. It is the key substance to spike during orgasm. In bonding, both as a cause and as an effect, it levels increase secondary to touch, levels increase with anticipation of touching. It has multifaceted role in attraction, touch, mating, sex, orgasm, bonding, labor, parenting, nursing, you name, in fact, whole lot of things actually are determined by that. Initial romantic situation, we feel hot. In fact, this may be attributed to the fact that the oxytocin effect. And any man, in fact, a nice girl comes and sits. In fact, that electric sensation we talk about again, this may be related to this particular fact. But unfortunately, what happens, the whole problem starts at the time of marriage. You talk to my wife, she will definitely say that I was so happy then I met you. She also makes another deadly comment. If you really loved me, you should have married somebody else. At the marriage, you are asked to hold the hand of the girl for 7 fair hours. At the end of it, the oxytocin effect wears off for the simple reason that tolerance develops very fast. And this may be one of the reasons why. In fact, even among the married people, many men spending a lot of time in front of the TV or with the mobile and lot many other things. In fact, cyber widow, that means that particular touch and other related things are actually missing. When you are trying to talk about female sexuality, cure is the cuddle. In fact, that's what actually precisely we talk about it. And a whole lot of therapies are related to this particular fact. If a man understands how actually to treat his wife as girlfriend, and he can bring, in fact, the range of activities which can actually be stimulating to both, in fact, he is actually very successful as well. When we are trying to talk about pleasure and happiness, these are the two different things. For the happiness, in fact, one of the very common complaint many women actually come and tell us is, I have money, I have actually the job, I have actually the very good husband, I have actually everything is fine. But all of a sudden, I am very tired, I am actually not happy, and many other such things actually they will tell. This is because unless a person mixes all the things, that means this is actually the theme slide, which talks about the role of dopamine, oxytocin, serotonin, endorphin, and unless we combine all of these things in a proper way positively, we are not likely to succeed. This is one of the reasons why, again, the relationship and other related things matter significantly when you are trying to talk about female sexuality, and we will reach to that particular level. Another 1 or 2 small points about the developmental issues. See, we are all well aware that we all started our life as female, but maybe somewhere around the 10th and 11th week, the genital bud and modification that actually comes, and we actually turn out to be something different. But what Freud mentioned, and how many people may not show importance, but all said and done, the woman starts with actually something missing. And this is what actually people have spoken about, Oedipal, Electra, and so many other complexes. And one important point is, developmentally speaking, there is a significant difference when we are trying to talk about the sexuality aspects. The males actually 2 or 3 years, in fact, slow as far as the woman is concerned and reaching puberty. But all said and done, the sexual interest in case of a male is 3 to 5 times more than actually the female. And this is one of the reasons why it matches somewhere around 35. And a partner who is 2 or 3 years or 4 years older than man is actually one of the best combination because of this particular component. Second thing, when we are trying to talk about adolescent and adulthood, the issues that boys after girls is one of the very common theme everywhere. But you look at somewhere around 45, 50. What precisely happens is these inhibitory hormones are reduced. That means the relative increase in testosterone, suddenly women become sexually more active, more demanding, more expecting actually as far as sex is concerned. Men are concerned, you talk about age itself, you talk about alcohol, drugs, and where is smoking and lot many other things. The metabolic syndrome and such other things. You talk about diabetes, hypertension, drugs for that. Each of this actually, in fact, drains man's energy to a great extent. That's where the couple who are actually doing very well for about 10, 20, 30 years now seeking divorce and lot many other such things actually, the reported things. One more. When you are trying to talk about menstrual cycle, there are a lot of people who come and tell us that I had sex with a woman who was menstruating and following it, I have become impotent and a whole lot of things. These are all socio-culturally speaking, the misconceptions why actually men carry. There are 2 phases wherein actually the woman is highly arousable. One is actually the mid-cycle. That's what actually probably God meant that, in fact, the reproduction to happen. And that other one is actually with the onset of menses. These are the 2 peaks wherein women is supposed to be highly sensitive for what we basically call sex. And this particular point one should always be remembering. The men are weaker sex. That's what I already mentioned to you in a few minutes ago. The woman's drudgery happens mainly because of she can be multitasker. Unfortunately, instead of using it as a very positively, men and families try to impose too many responsibilities on the woman that leads to quite a bit of difficulty. I'll tell you an example, just very recently what I had case. In fact, he is working in a software engineer, one of the companies in Bangalore, and she's from Mandya, and both of them staying here. She gets up in the morning. In fact, she is also a software engineer. She gets up very early in the morning, cooks food, goes to the office, they finish the job and come back and again come home and then actually cook. Though mother-in-law is there, she believes that it's his daughter's responsibility to cook food. And at the end of the day, she's so tired, and this was one of the major complaints what she was mentioning. So here the treatment here is not actually something extraordinary, techniques. The simple method is actually how we can reduce our drudgery day to day, what's happening. What is I'm trying to convey message is, possibly a maid was there and she could have taken care of her responsibility to a great extent. The problem would have been solved to a great extent. So we have to look at the problem from that particular angle. So reduce the drudgery, give her free time, enough time. In fact, that way, in fact, she can participate in many of the activities what we are expecting sensuality wise. In fact, this can actually work. And one of the important point is actually women sometimes give messages which actually confuses the man. This particular diagram should have been little earlier. A woman telling that I want something, she should express it. And she telling the husband that I want brinjal color saree. See, a man cannot understand what is that brinjal color saree. You must tell him and show him that this is what actually the color of the item actually what I wanted. And I'll tell when we are actually having therapy sessions, many women tell that, in fact, he goes to the bathroom without taking the towel. He asks for the towel. And when he comes home from the office, he expects me to give coffee. I always tell, absolutely there is nothing wrong. In fact, men's, when you are trying to look at testosterone, it is released in the form of pulses, maybe about 20 seconds, 20 minutes, 30 minutes. And if you are able to handle it in proper way, you start telling 100 problems what actually happened all through the day, and suddenly he also flares up and goes out of the house, and rather than that, do it in simple way that, in fact, he will be like a lamb after those particular few minutes of what we call testosterone effect. That's very wrong. He cannot understand, he cannot multitask, he cannot do many jobs together. What I want it from the market. In fact, this particular lady giving it in writing, how she expects him to bring the item. In fact, there is no confusion for the husband. Women, please remember that men are actually, in fact, cannot do a lot of things as they expect. And this may be one of the whole reason why a lot of families land up in quite a bit of difficulty. Intimacy and other related issues are extremely important. In fact, we almost always say that happily married means he is here and she is somewhere else. That is why, otherwise, when they are together, invariably it leads to quite a bit of difficulty. Love is the answer, but many of the time we will be sleeping with the enemy. And when we are trying to talk about sexuality component, some things have been easily understandable, like say identity issues and sexual function, physiologically speaking, different stages, what Master Johnson has elucidated in very simple terminology. But the seventh item, what Levin speaks about, emotional satisfaction. This is actually what is missing in many of the cases. So the whole effort in the treatment is how this particular aspect can be brought about. It may be socio-culturally speaking, many aspects, but they are all extremely important in what we're trying to talk about, the management of the female sexuality. So intimacy, when we are trying to talk about, I invariably use this particular diagram because I married a wrong person. Either man believing or woman believing is actually the recipe for a whole lot of difficulties. If both of them adjust, both of them are happy with, and many of these type of things can be solved without much difficulty at all. And when we are trying to talk about management, unless this actually the relationship issues are solved, we don't succeed in actually what we basically call management of sexual problems also. Sensuality. In fact, many women actually tell the men are actually dirty. They look at women and a whole lot of things. I still remember in one of the book, one of the ladies' question, I have just printed in there actually. She says, I am very well endowed. Still, my husband looks at other women who are having bigger busts. See, that way she was asking me, give me some medicines to increase the size. You look at it. In fact, whatever we size you increase, there will be another woman who is actually a little better, bigger, and a whole lot of such things. And I still remember how a woman's attitude is a little bit of change. I was doing my final year MD, and one of the senior fellow coming and telling this other lady, while your husband was on the way, he was looking at other women. Her response was very simple. More hungry, that much better. So you look at a little bit of change in attitude can bring about such remarkable changes in the whole this thing. And what we basically call, there are a lot of aspects which are extremely important. I'll just tell, keeping in mind the time constraint, there was a man who came and told that, sir, my wife, she doesn't take bath every day. She will be always in the nightie, which I feel not arousing. I feel put off. When joint session and discussion came, this issue, the wife's comment was very simple. Sir, please tell him I am not his girlfriend, I am his wife. See, look at the whole aspect. Because I'm married, I don't want to keep myself proper, can lead to a lot of difficulty. You want, in fact, the man to be aroused and show interest and be active and all means, there is a lot of responsibility even actually a woman actually need to carry. And this may induce sexual excitement, but goal is not intercourse or climax. But it is extremely important step, the sensuality, when you are trying to talk about female sexuality. I think the last item, the sexual response cycle. We are all well aware that man is very fast on the gun. He gets aroused. He is just like, say, any incandescent bulb. You put the switch on and it is ready. But woman, in fact, sexologists compare her to Stree means Istri, iron box. You put the plug on, it takes its own sweet time to actually get aroused. She can reach the P and she can actually be multi-orgasmic too. This one may be in the laboratory situations, but actually many of the times females can experience multiple orgasms or may not experience orgasms at all like that. But all said and done, all permutation combinations are actually possible. And DSM-5, you might have looked into the recent classification. In case of man, we can very classically describe about desire phase, arousal phase, and other related things. The female, this is actually very difficult. When actually the desire, when actually the arousal, very difficult to comment. This is one of the reasons why the female sexual interest and arousal disorder has one component. The pain and penetration disorder, which actually the vaginismus and dyspareunia, which used to be their earlier classification, this has been brought out as a single category. Sexual aversion disorder, which used to be there earlier, and hypersexual disorder has been knocked off. This is extremely important because when you are trying to talk about women, in fact, primarily predominantly the romance, sentimentality, and lot many other things actually occupy. David Reed's erotic stimulus pathway talked about seduction, sensation, surrender. In fact, these are the phases, very romantic terminologies, but all said and done, instead of very classical mechanistic terminologies, what actually Marshall used, this actually talks about very significant change. And this is one of the circular model, what actually Basson reported. The woman's sexual responsiveness can get affected at multiple points for the whole range of reasons. And unless, in fact, she is able to focus and the distractions are minimal, it is almost not possible for her to reach orgasm. And this may be one of the reasons why many women complain about, you turn me on, but you don't know how to actually take me to the peak. For man, it is very easy. For the woman, whole lot of things are actually necessary, and they're all actually relationship issues. This is from Clinics of North America. What actually, in fact, this meta-analysis showed was this fantasy alone, a small number of women can reach orgasm. With sexual intercourse situations, about 29, 30, 32% of the women can reach orgasm. With touch alone, in fact, it is possible for the woman to be taken to the orgasm. And what actually, in fact, certain studies, maybe a little exaggerated, with the vibrator stimulation, there is nothing like anorgasmia. In fact, a woman can be taken to orgasm without much difficulty. In fact, this is actually the report. Plus minuses are possible in what actually has been documented. We did a study on about 500 plus women from the elite group. Of course, they were all wives of what we basically call Lions Club, Rotary Club. And what we found was that around 32% of the women reported masturbation sometime. Among them, only about 12% were reasonably comfortable. What it means is, in fact, many women in our country, they don't even know what is actually the pleasure, orgasm, and things like that. The reported figure for the Western countries is somewhere around 60, 70% and all of that. So this is one of the major common problem what we have. And we have to keep this particular point in mind. Any inhibited female sexual functioning and woman alone you are trying to treat, it is nothing but treating the woman in what we basically call training her in masturbation. And the whole sensate focus exercises are related to actually how precisely this particular process can be achieved in a very systematic fashion. There is a whole lot of issues that have come up currently, the people talking about it. We are all aware, prevalence, the problems in clinical practice. Almost about 1/3 of the men and almost half of the female population have the problems, and try to treat them with a whole lot of drugs. You are talking about SSRI. It produces more problem in case of females compared to, in fact, in case of males, and anorgasmia is one of the extremely commonly reported problem. And who presents, how they present, one can go into lot many areas, but important point here is actually many of the time it is not expressed, and it is our job to see that we actually try to take this particular aspect into consideration and talk. That particular change in our attitude, that we actually inquire at any woman who has come with a whole lot of complaints and all of that, extremely important. Why this particular diagram? Many women present with chronic fatigue, host of minor discomforts, insisting on repeated evaluations, dramatic intensity of symptoms on and off, progressively seductive behavior, who get relief from diagnostic procedures, unable to relax during exam, or in fact, emphasizes emotional cause and de-emphasizes emotional cause, those who depend on injections, tonics, etc. In fact, these are all extremely common. whole lot of aches, pains, burning sensations, and in fact, very specifically the burning vagina syndrome and many other such terminologies people have used, which all indicate that there is actually something problem. I am not going to elaborate on it because these are all available. There are plenty of studies available. Say, for example, in different continents, actually how the problem is. Among Asians, different studies are available. Among the females, the type of problems. There are a whole range of European studies. Whole lot of what we basically call the specific, what we call clinics, OBG and other areas, OCD and other anxiety disorders, alcohol and such other use disorders, and those with unconsummated marriages, and actually the problems related to that. Why I'm emphasizing unconsummated marriage is, here, the problem is much more bigger than actually somebody who is having some problem at some particular point of time. Both the couple need very active management and looking into, and later some questions come. We'll try to talk about those things. We did a study on extent of problem in Mysore, and what was reported was actually almost about 40% of the women had one or other sexual dysfunctions in the general population. So the idea here is actually to make us aware that the problem could be extremely common, but not recognized is actually one of the common situations. Coming to therapies, there are a lot of women who find it very difficult talking to the males. Some people are comfortable female and insist on that particular point. How actually your clinic can be organized in that particular fashion, you should look into. Individual versus couple. In fact, when person alone comes, even when couple come, many of the times we don't succeed in management for the simple reason that women find it very difficult because there are very few husbands who cooperate adequately and actually they're willing to come for therapy. This is one more other point. Partner presented as normal. One of the classic example, in the initial part of my practice, there is a man who married to a distant cousin's daughter, and she was never allowing him to actually come near. Sexual aversion disorder, that was actually the diagnosis made. But later when we had occasion to go through the whole case, at one particular point he came and told, sir, please treat me for ED. Why and how? In fact, the explanation given by him, at the end of 4th year, he told his mother-in-law that he cannot wait any longer and he wants to marry somebody. Mother-in-law told him, come to home tomorrow afternoon and everything would be all right. He went home and there is a cot put in the hall. There were about 5 or 6 ladies and each one trying to catch her, and they brought the girl to the cot. One lady holding one arm, another holding one leg, another holding another arm, and somebody lady pressing abdomen. They told him, now you perform. He says he removed the pant. He couldn't get the erection. They told him that you are not a man, why you are making fuss? In fact, he comes running to the doctor telling that I am actually having problem, please help. So many of the times the vaginismus and lot many other such problems are actually not traced and brought to the focus at all, for the simple reason that in fact the men's problem get emphasized. And when we are trying to talk about evaluation of the case, history is one of the extremely important. History. Of course, when you are trying to talk about evaluation, ruling out starting from, in fact, there are a lot of women, when we are trying to talk about evaluation, anemia is one of the extremely common problems. Just like in case of men, there are a lot many other metabolic and other such other issues we definitely need to look into. You give a chance for them to actually ask any difficulty they have in concerning sexuality. But many women actually come forward and they speak about a whole lot of things. And talking to the women separately is extremely important, because domestic violence, substance use, intent to live relationship, infidelities, individual psychopathology, health problems, they will never be able to share very frequently, commonly with the partner. And in fact, that can lead to quite a bit of difficulties too. So as a therapist, we have to be sensitive to some of these type of things and actually plan our therapy. We have spoken about men and having a lot of myths and misconceptions leading to quite a bit of difficulty. Women also have the range of myths and misconceptions. And when we are trying to talk about dysfunctions and the relation problems, extremely important, because see, man is able to perform with one and is not able to perform with the partner. This is a relationship problem. It is not actually the sexual problem. And when we are trying to talk about women, expecting the man to be in some particular fashion, expecting him to actually earn some particular way, expecting him to do certain things in some particular fashion, They all could be actually the difficulties in the relationship rather than actually what we talk about, the sexual difficulty. And when you are trying to talk about evaluation, whole range of aspects are necessary, both physical, psychological, and social. Almost all these components are necessary to be looked into. And in the same fashion, there are a lot of scales available which can actually document the extent of problem present. If somebody is interested, if they are able to send me one mail, I can forward this review article by Dr. Sandeep Grover in our Journal of Psychosexual Health, assessment scales for sexual disorders, a review. We have reviewed quite a bit of scales for the convenience of young people. When we are trying to talk about treatment, Anand, when we introduced how actually one can proceed, permission, limited information, specific suggestions, and intensive therapy. And those intensive therapy means there is a whole lot of things actually that need to be done. But from our practical point of view, many people need just permission. Say if there is a woman is having idea related to that menstruation is one, actually that time we should not have sexual intercourse. Maybe permission giving, limited information related to what actually happens, specific suggestions related to this particular area. So this can be utilized from our specific individual, and treatment can be done. There are only a small percentage of individuals where intensive therapy is actually necessary to be called for. I have a way of looking at it actually, just like in case of males, ignorance, we try to need to give education. A lot of cultural taboos and myths by permission giving, poor communications by teaching communication skills, a specific precipitating factor present, how best can be actually overcome, unrealistic goal related to the success and performance pressures, and actually how one can go about. This ladder concept is one of the idea is that when we are trying to talk about intensive therapy or sunset focus, the one step to the other step should be so smooth that in fact it should look like a ramp rather than actually the steps. And sunset focus, I will not elaborate too much on that, but important point is when you are trying to talk about sex therapy in case of females, this is actually intended to enhance the loving intimacy and not necessarily actually just getting orgasms. Success is unlikely if relationship is in problem or problem of psychopathology in one partner. Vested interest to remain dysfunctional, and for those adjusted to dysfunction, do not impose sex therapy. This is in fact not equal to just writing some medicines and all of that. And for choices, doctors have no other this thing because we actually definitely need to look into it in the coming days. Dysfunction cannot be treated in isolation. Individually is almost always seen in the context of relationship. In fact, one of the best approaches is actually utilizing biopsychosocial model. And this is to help couple function optimally. We need to provide basic information related to anatomy, physiology, eliminating myths and false expectations, removing performance anxiety. And this is one of the reasons when you are trying to talk about couple therapy, in fact, prescribing sex in the beginning, during that particular time, giving them adequate education, and then actually proceeding and individualizing treatment. So when we are trying to talk about the management of female sexual dysfunction, the multifactorial aspect is one of the very important things. In fact, starting from the family, what she has, to the physiology and the psychological aspects of her performance, to the use of drugs and other related things, to the specialist who actually utilizes this particular opportunity. In fact, all of these things are actually extremely important. When we are trying to talk about female sexual interest and arousal disorders, our job is to first establish whether there is an organic factor to treat. And if that is the case, of course, that need to be attended by a person. Comorbid psychiatric disorder present, making use of a whole range of treatment techniques are available now. Actually, in fact, I am going to talk a little while later about which don't interfere with sexual functioning. When you are trying to talk about depression, extremely common, try to choose a drug which doesn't likely to interfere. Currently, we are talking about, say, ortioxetine as one of the very important molecule, which has no sexual dysfunctions. Vilazodone, agomelatine, two, in fact, little less, of course, mirtazapam, sertraline, and so try to choose a drug which is actually better. General behavior management, marital therapy, individually actually attending, all of these things are extremely important. And what actually people have documented, hormonal treatment sometimes too, in fact, use of what we call PDE5 inhibitors in certain situations, fine. as far as the female are concerned, the flibanserin, brimonidine, two are the other drugs actually which are there. I'm going to come 1 or 2 minutes later. And when we are trying to talk about behaviorally speaking, invariably there will be difference of what we basically call a responsiveness between man and woman, and how actually the whole therapy is to plan it in such a way that, in fact, certain changes he can bring about and certain changes she can bring about. Communicate clearly, differentiate between an invitation and demand, try to let simmer on the low. Rejection is not an act, rejecting an activity, not rejecting a person. And a whole lot of psychotherapeutic techniques are absolutely necessary to be activated. Sexual aversion disorder, I won't go into the too many details because now this has been taken off from our DSM system and it is almost treated like a phobic disorder. For all practical purposes, it is true. And when you are trying to talk about orgasmic disorders, now we don't talk about frigidity, anorgasmia. This is actually, it is a pre-orgasmic state. Almost it is possible if a partner is actually trained, all women can be taken to the orgasm. This is what actually the science speaks about. All women are capable of having orgasms. Many women, difficulty through vaginal stimulation alone. 70% achieve with concurrent direct clitoral stimulation during actually the sexual functioning. And many other such points are actually well documented. Primary, secondary, situational, generalized, and in fact, many of these type of things are actually how to go about. So coming to the guidelines for couple therapy, ruling out organic problem, establishing ground rules, being an intimate team, that way one unit, relationship problems. In fact, what we see, well-behaved in the drawing room, but in the bedroom, there is a whole lot of problems are happening. Attitude change, cognitive restructuring, video models, reading materials, therapeutic verbal modeling, lot of other such educational techniques one can actually make use of. Reduce performance anxiety, prescribe sex. This instruction should come from you for both the people. In fact, it is not the woman says to the man or man says to the man. Focus on comfort, pleasure, and erotism. Sexual intimacy through skill building, non-demanding sexual pleasuring exercises are there. And I'll not go into too many details, except that sensate focus, starting from one partner giving pleasure to the other, then mutual to the genital contact, female superior position, insertion without movement, with movement, and actually the one can achieve certain things. Why actually this particular thing, each of these area extremely important for us to understand. I will not go into too many details related to that. People have spoken about female Viagra, flibanserin, but our experience with this is actually very limited. But we have reviewed the whole detail related to this. In fact, the 4 related studies wherein, in fact, not found that much useful at all. At least at the 8 weeks, it doesn't show response, there is no meaning in continuing with that. So flibanserin is one of the extremely important drug that has come into the market nowadays, and one can use it. Brimonidine, in fact, we don't have much idea related to this, except that what we have reviewed and the data available from the Western countries. And in the management of female sexual dysfunction in general, in fact, PDE5 inhibitors, buspirone, bupropion, and lot many other things people have tried to, including herbal supplements, hormones. In fact, a whole lot of these things where particularly hormone replacement therapy and all in certain women is absolutely necessary, and pain penetration disorders by use of dilators to a whole lot of things, and how actually one can go about it is actually one of the questions that need to be answered in greater detail. So in conclusion, management of female sexual dysfunction, non-pharmacological lifestyle changes are extremely important components to be kept in mind. Psychotherapy, more than anything else, the spare time. In fact, I'm emphasizing again and mainly because this may be one of the very simple reasons which actually may be actually creating a whole lot of difficulty in the woman's life. And few concluding remarks. Don't expect a perfect husband. In fact, it is not likely to happen. And who is there, how best to make use of him. Actually, in fact, this is one of the things. Sex is a conversation carried out by another means. If you never try, you will never succeed. In fact, this is one of the important points. The woman is a beautiful melody when the man is a good musician. And when we are trying to talk about this, the magic of man-woman, this is what actually our aim and purpose, and a range of therapies are available how one can actually go about. Intimacy, relationship matters, and we have certain books available. If somebody requests, we can actually forward some of these things. The clinical practice guidelines are available, which talk about indianjpsychiatry.org. In fact, very easily it is available. What I'm trying to convey the message is female sexual dysfunctions are common. Our whole attitude and interest in this particular area, which is neglected so far in a very big way, that need to change. It is difficult. One has to learn properly, but all said and done. In fact, when you consider that almost 50% of the population is actually the female gender, why and how this much length of time it has got so much neglected, particularly in our country. I think that attitudes change, and all of these people who are listening to this, I'm sure they're all change agents and things would be better. Thank you very, very much for this wonderful opportunity.
Hello.
I'm trying to stop share over 1 minute. Oh. I'm not able to, that cursor I'm not getting in the thing.
Yes, sir. You're
Okay.
I've done it, sir. Don't worry.
you have
I've
done it, sir. You have done it.
I've done it, right? Okay. How to get back?
Yeah, as usual, it's a wonderful presentation. And as you pointed out, like men traveling very fast from Mysore to Bangalore. Yeah, I mean, like your expression and your presentation is very fast. But anyhow, it's very interesting with what you call audio visual, effects. And I would say it's, I've heard you many times, and I'm sure every time you listen, we know that you have added something else. So that way, I think I'll leave it to my co-chair and also others who have got questions to ask you. Yeah.
Thank you so much, ma'am. Thank you so much, sir. It was such a wonderful and interesting presentation, sir. There are some few comments from the chat box and question and answers. Sir, Prasad Rao, sir. Sir, Prasad Rao, sir.
Yeah.
He's the man
Sir,
who knows how to handle a woman so excellently.
Sir,
Yeah,
will
yeah.
you
He's a
please
woman's man.
express some
Yeah. First of all,
of
let
your
me
views, sir?
congratulate.
Prasad Rao, sir.
Yeah. First of all, let me thank George Reddy and the IPSTS for giving me the opportunity today to just share my feelings about what TSS talked about, the content, both his content and my own feelings. TSS, as usual, is the total sex solution row of Indian Psychiatric Society. And as usual, today he talked quite, I would say, scientifically, bringing the nuisance and sensitivity of a woman. But I just want to add only 2 or 3 important things. It's not that, in fact, we both were editors together. And I think one of the book here showed in the slide, we both have authored and we authored together. The basic thing what I think is today's young women are much more different when compared to what our chairperson, Dr. Gauri Devi, talked about. Yes, during those times, the women are generally told, go to your in-laws house and follow the in-laws tradition. Today, I think women, thanks to the education and especially the psychological education and the variety of sources, I'm particularly happy. And I see in my day-to-day practice everyone. But my own concern, and I would think TSS would agree with it, most of the residents in psychiatry whom I have come across the country and some across my hospital too, are very shy to ask question about sexual history, both for males and females. And when the patient comes for the sexual problem also, they don't like to go into the details. So I think TSS and some more TSSs from Telangana like Vishal Akula and all, who are the young torch bearers, should actually change this way. And I would request Anita Rairala to just take over this particular as an important aim in the next 2 or 3 years to in the CME, PG CME, and I think we should talk to the PGs. Thank you, TSS, and I would once again like to close only one thing. Today, for the first time, you have not used my name at all in my presentation. Thank you very much.
In fact, the female sexuality,
Thank you
wanted to
so much,
use
sir,
the
for giving this.
female's name. And one of the important point what Prasad Rao brought out is actually that relationship matter. And world is changing and relationship patterns is also changing quite a bit. And women's expectations are something totally different, and we can no more wait and watch. I think we definitely need to change ourselves.
Sir,
Anita,
points
there are
well
many-
taken, sir. Question
There are many
from
questions,
Dr.
Anita.
Sir, yes, sir. Yes, sir. I'm
Yeah,
asking
please go ahead.
a question from Dr. Paresh Shah. He is asking any medicines to reduce libido in females.
Okay,
To
already
reduce
your
libido
low
in
libido,
females.
already low libido, and adding anything to reduce libido is not something actually we try to look at. See, the women who are actually respond significantly without much difficulty, there are very rare species. In fact, many of the common problems, see, I'll tell you one of the, if you take it as a joke also, but all said and done, there was one African and one American and one Italian. Italian says that when I have sex, it is about 700 calories I'll burn. American says 1,200 calories. African says 1,500 calories. Then Indian says, to make her agree, I spend 2,000 calories of energy. This is actually the story. Any drug we use, say antidepressants to antipsychotics to anxiolytics to anything, in fact, for all of these type of the drugs can actually reduce the woman's libido. It can happen in men, but it can act very significantly in case of women.
Yes, sir. Thank you, sir. We'll go to next question, sir. Dr. Sai Kumar is asking, India needs a National Institute of Sex and Sexuality with multidisciplinary approach to do research, train, and offer services. Do you agree?
Absolutely. In fact, one good thing that has happened, at least initially we thought it is actually wrong thing to do. Now, sexual aspects have been taken into a special section in International Classification of Diseases. See, ICD-11, the sexuality has been given a special chapter altogether. The reason why, see, earlier days, people thought that this is purely psychiatry. That's why actually many other branch people, they didn't show interest. And initially, when a lot of studies were there, we used to believe that everything is a mind phenomenon, and in fact, that way. Now, it is believed that sexual problems are multidimensional, multi-system related, and that need to be definitely looked from all angles. And a section has been given. And in India, things are changing for the better. To be frank with you, now we have about 100+ people who have undergone fellowship, certificate, and other programs. I'm very happy to say Vishal Akula is there in the forthcoming program, at least with another 3 of his friends. What it actually means, not that they are not knowledgeable, but it is actually mutual learning. And we are trying to understand how precisely the sexual problems are present, how precisely this to be handled, how precisely we can benefit people in general. I fully agree with that point.
Thank you, sir. We'll go to next question, sir. Dr. Nivedita is asking, studies on porn content consumed by both genders conclude that women consume verbal porn like erotic texts and novels, etc., compared to visual in men. You say men cannot express, then how do we solve this riddle?
See, the point is, see, when we are trying to talk about porn, the female in general not looking at hard porn and lot many other such other things people have documented, and anything related to the mills and bone type of stories actually which attracts them, and thereafter. In fact, these are all few of the things which actually have been documented. See, I'll tell you, there was a lady who just about 2 days ago, she was telling, I prepare very nice food at home. But this fellow doesn't say anything good about food. Then I asked her actually whether he eats well. Oh, he is very happy about my food and he eats well. That's what he is conveying. In fact, this fellow doesn't know how to tell you that you prepare good food. He is eating food eating food well and eating food with a lot of satisfaction, he is already conveying. In fact, this is what actually we have to look into. Men are very poor. In fact, one of the most common thing is actually, you ask a man who has come from the office, how was the day? It was good or bad, only 1 or 2 words, actually that's the end of the story. You ask a woman, she speaks quite a bit about whole of the story, like an essay question she may be answering. These two differences are very well documented. Men are not trained to speak. Men are trained not to express. Men are trained not to, in fact, understand a lot of things. And this is one of the difficulty many of them go through. Where necessary, training them. Otherwise, one should be able to understand what is actually precisely happening. And this is the way actually the gender behaves. I think that brings about difference.
Yeah, thank you, sir. It was a very good response, sir. Another question from Dr. Kasturi Pandian. She's asking, how does sexual dysfunction differ in lesbians?
See, of course, I literally left it out mainly because the gender-related issues and what we basically call the paraphilias, I was not trying to bring into the focus here. The dysfunctions we are trying to talk about, which is actually related to the sexual responses. As far as the women, either lesbianism or homosexuality, they are no way different from us. Here only the orientation, that means what we are attracted to is only the difference. Our sexual responsiveness is not actually affected in this particular, these individuals at all. The process involved is same. But what is actually necessary to continue that particular process or induce that particular process is actually the stimulus. There is a difference. In fact, there are almost like homosexual men, women, after a certain time, relationship breakdown and all, they land up with as much difficulty and as much problem as the heterosexual couple. This is what actually which has been documented.
Yes, sir. Thank you, sir. Next question by Dr. Om Prakash. He says, I have a few cases wherein wife comes and suspects that husband is gay. How do we handle this? How do we intervene and what's our role? Husband is gay. Wife suspects that husband is gay. How do we handle this? How to intervene and what's our role?
The important point is, many of the times suspecting husband is one of the very common theme in many relationships. Not because of anything, but because she feels insecure. What will happen? Why actually the change in his responsiveness and why certain relationship issues actually deteriorating. Invariably, these are all actually likely to lead to what we basically call suspicions on the part of the wife to suspect husband. But to suspect why he could be gay and all of that, in fact, unless one has to talk to the husband and talk to him separately and talk to him with confidence, this may not be easy. But it may be one of the rare situations wherein actually this may be the case, but all said and done, history. That's what we have spoken about as far as the women are concerned. And the same job need to be done actually with the husband also. We need to definitely collect information and actually deal with that. We have come across people who unconsummated marriages for about 1 year. In fact, I still remember we had admitted a lady for a little histrionic and other related symptomatologies. We came to know it is actually unconsummated marriage, and the issue was he was not showing any interest at all in her. Later, when family raised the question and many other things, and then we later came to know that, in fact, it was issue related to the orientation problem and things like that. So there are some specific problems which crop up, which indicate that this could be. There are some examples where who could be bisexual, and in fact, many of the time, either premarital sex, extramarital sex, and this type of homosexual relationships and all of that. Unless some problem crops up, it may not be possible at all to recognize it. The difficulty would be there.
Yeah, sir. Thank you. Sir, one more question from Dr. Nagabhushanam. He is asking drugs which increase libido in female. What are the drugs which increase libido in females?
But just like, see, for example, as far as the physiology is concerned, men and women, there is not much difference at all. See, any drug which enhances, say, dopamine mechanism, take an example. It is a drug which is also likely to increase the libido. See, for example, the age itself can bring about changes I was talking about, with a relative increase in testosterone. And the hormone replacement therapies. In fact, the decreased libido in case of female, because of the estrogen and the related hormone deficiency itself, and that's one of the things, hormone replacement we talk about. Adding testosterone can bring about significant change, more particularly in case of libido, and how to go about without bringing what we call anabolic, or in fact, male hormone related changes in the woman's body. The libido alone, how actually to enhance and all like that, there are data is available. So that means starting from drugs which we very commonly use as antidepressants, more particularly those which act on what we basically call dopamine mechanism, they're all beneficial. See, when we are trying to talk about, see, WPA classification talks about axis 1, A, the sexual problem for which they are presenting, B, the comorbidities. What actually they say is actually the libido is affected. One of the things is actually the incipient or not so well recognized depression and things like that. Use of antidepressants can help and all of that. So individualizing the treatment and looking into the problem is extremely important. And the same rule what applies to male applies to females also.
Okay, sir. Thank you, sir. Next question, sir, by Dr. Narasimha Reddy. Any specific problems related to sex in software employees? Your comments.
Absolutely common. He is earning quite a bit. She is earning quite a bit. In fact, everything 6-digit salary. But unfortunately, we have come across in fact, one of the term joint family we use. Joint family means we have a different meaning altogether. Joint family among some of these software engineers says both husband and wife staying together. No, you got the point. That is joint family. They don't get time actually to stay together itself. In fact, he hands over the key to the wife because she has come from the night duty and he goes for the duty. No, you got the point. The common ground for them to meet is somewhere in the corridor, wherein actually they are exchanging the key. Extremely common. The second point, their working pattern and all, there is a whole lot of differences, what actually we have found. In fact, I have from Mysore and Bangalore. These are all IT capitals, maybe Hyderabad, another area what we can talk about. Plenty of people. They have studied so well, in fact, double graduates, PhD holders and all of that. Hardly know anything about what male anatomy, what is female anatomy. In fact, there are people, a lot of adventurous people are also there, but majority, quite a few people. In fact, many of the software individuals have hardware problems. This is one of the jokingly I always tell. Hardware problem you have to see commonly means it is with the software engineers. Extremely common. Though the data is to some extent available, the clinical practice definitely indicates that this is actually the situation. In fact, the sex and computer doesn't make much difference. If software gets into the hardware, this is called computer. Hardware gets into the software, that is called sex. This is another way to look at it. These software people have a lot of problems.
Yes, sir. Thank you, sir. Going on to next question. Dr. Vijay is asking, current generation are very much self-aware. Aspects related to sex available on the internet. How they have to understand about how to connect sexually.
See, the problem is again the software hardware we are talking now. See, for the computer fellow, now I am pressing some buttons. The whole lot of things I can get the screen, I can ask the people to talk about, and something is actually happening. The one window opens or another window opens. Now you got the point. A software engineer fellow thinks that I press the button and she will respond. No, you got the point. They are human beings, they are emotional, and a whole lot of things are there. This is actually what is missing in them. The point is, see, what is virtual and what is reality, there is a whole lot of differences there. In fact, I still remember many of the people can see a young adolescent boy taking the gun and shooting a lot of people, driving the vehicle very fast, and 100 other such things they can do on the press of a button. But dealing with a person, in fact, hardly this is actually trained for these people in individuals in proper way. This is the whole difficulty.
Yeah, sir. We have finished 1 second, sir. One more question I think we have got. Sir, please explain the effect of alcohol in female sexual dysfunction. This is a question from Dr. Rajesh. The effect of alcohol in female sexual dysfunction.
See, if you try to look at many of these romantic situations and all of that, people consuming small amount of alcohol, maybe the wine and a whole lot of things actually to bring the ambience, make the situation comfortable. These are all very well known. But as far as the alcohol is concerned, we have a whole lot of data available that the extent of impact it has on women, their health and sexuality is something quite significant. One important point is actually even the less amount of alcohol, because of fat storage, it can act quite differently in them. The enzymes which are actually necessary to break down, they are significantly deficient. This is one of the reasons why the women respond in a very significantly different way compared to men. Many of these things are very well documented. And somebody dependent on either alcohol, other drugs, or many of these type of issues, if something is giving pleasure, the partner actually gets totally lost in the whole process. I will look at this problem in another different way. We were conducting one of the programs along with Pratima Murthy that time. She had come to Monday, and this particular program was related to drug problem prevention related aspects. And wherein the last session was husband and wife come and they should tell on the podium what is actually the issues. One man came and told, sir, I drink alcohol. I am not like other men. I come and sleep off without giving any trouble to my wife. When her turn came, she responded, what to do with a man who comes and chumma sleeps? No, you got the point. See how beautiful it is. I still remember. As far as the women are concerned, though it actually relaxes and make them less inhibited possible at some particular stage, once the dependence and regular usage and lot many other things, it produces worst scenario in women than actually in case of men. Apart from that, of course, non-marital situations, the impact of alcohol and other related problems are very well documented. And of course, I will not be elaborating on that.
Thank you, sir. Last and final question, sir. Sildenafil, tadalafil, vardenafil, or combination of depoxetin, when are they indicated? Your view on this and in erectile dysfunction and premature ejaculation.
Okay. See, what is being said is that in fact, there is a very detailed review related to all these PDE5 inhibitors in Journal of Sexual Medicine, and few conclusions what were reached. One important point is almost all PDE5 inhibitors are almost as effective as anything else, any other PDE5 inhibitor. That is one aspect of it. The second point is all of them are very effective drugs. We have to use effective dosage. Say what it means is, say when you are trying to talk about sildenafil citrate, don't label it as ineffective with 50 milligrams, and sometimes men may need 100 milligrams to 200 milligrams. And the fourth point is, though people respond extremely well, many of the times actually they don't continue, not because of anything, but many believe that it is actually something artificial. The fifth point, if somebody takes some of these PDE5 inhibitors and sleeps, maximum hairs on his head will stand up. To get erection, the mutual stimulation, either fantasy and lot many other things are necessary because nitric oxide mechanism that need to be triggered. So now coming to these three drugs which have been specifically, vardenafil will keep it aside because not available in our clinical practice. The same principle applies there. Sildenafil and tadalafil. Sildenafil is a short-acting drug. When actually one is aware of the availability of the partner and one can plan it comfortably, this is supposed to be the best. And the best, what we basically call a hardiness related to the penile engorgement and all of that has been reported with sildenafil. When you come to the tadalafil, its half-life itself is around 36 hours. What it means is, when individual is not, say for example, the girlfriend or wife is supposed to come by train, but the train has got delayed. We don't know when actually she will reach. No, you got the point? This is called as weekend drug. When you are not clear about what is actually happening and you want to keep the wide window margin, so tadalafil is a better drug. You take an example in that particular. So we are an a la carte method. What is actually being suggested in literature in PDE5 inhibitor is try one other who will respond to what bed, what drug. In fact, one can actually make an assessment and one can continue who is comfortable with what drug. This is actually a story with, say, for example, when you are talking about Udenafil, a lot many other newer drugs where endothelial functioning, they are much better drugs. And when somebody is having certain relative contraindications, say, for example, somebody is using what we call, say, drugs like nitrates and nitrate donors. The in-between duration, a short duration only, some drug need to act. Sildenafil would be a better drug. Tadalafil, because of its long action, this is not actually something to be chosen. The third point, when actually necessary, people nowadays, they suggest that 5 milligrams per day or 10 milligrams per day, regular usage. In fact, they are all beneficial for the heart and the individual will not get heart attacks and much longer time he will live. These are all advantages. And hardly tolerance has been reported. And these are all very safe drugs. See, for example, around 800 milligrams, accidental consumption, nothing really has happened. We have published case reports where 1,200 to 1,400 milligrams per day for 2 to 3 years. Hardly anything major systematic problems, actually. So they're all very safe drugs. One need to determine that particular. See, when you are trying to talk about ED and PE, they are two extremes of the problem. Many of the times people come and tell us, I'm having, in fact, our postgraduate students, they'll say he is having PE. He is having diabetes, and the problem is he has sex once in a month or once in 2 months, and early ejaculation is not actually PE. When we say PE, one should document that there's a regular sex that is happening. He has no control on that. He ejaculates before he intends to. So that means these are all the few points we need to definitely document. Mistakenly, people actually label what we basically call an organic problem, producing both of these things. The other third one, if somebody is having PE, for all practical purposes, this is actually an anxiety-related disorder. So far in the literature, apart from his what we basically call body's responsiveness speed, there is hardly anything which has been documented as organic which can produce PE. There is no drug which has been documented like that. That means when we are trying to talk about evaluation in a PE case, one need not have to worry at all. Now look at, see, depoxitin acts only for a short duration, 4 hours. Here is an anxious individual, 4 hours action is not going to be sufficient. In fact, if PE alone, try to choose an antidepressant which gives benefit. I'm very comfortable with sertraline. Somebody may be comfortable with another medication. It doesn't really make much difference. Paroxetine is the highest blocker of what we basically call, but unfortunately, it acts like what we call as nitric oxide synthase inhibitor. So small dose. What I am trying to convey message, if anxiety is actually the basic problem which is present, try to choose an antidepressant which is actually having a long-term duration and beneficial effect in controlling his anxiety. In absence of it, depoxitin is the drug which can be chosen. Now, combination drugs are available plenty, whether 30, 60 milligrams. In certain individual cases, even that can be considered.
Okay, sir. You answered all the questions, sir. Almost we came to the end of the session. I think I can ask Dr. Gauri Devi, madam, to respond.
Madam, Anita, madam.
Kishan wants to
Yes.
say, he has raised his hand.
Yeah. Yes.
Kishan, sir.
Dr. Pawan, please.
I'm congratulating Dr. Raj Reddy and Pawan for arranging a very good talk and both wonderful chairpersons. Only one point to share with the cases now. Sir, you told that usually in spirituality, I will repeat that females are powerful than males. That is generally that I quote. So in the sex also, what you are telling that they get climax, they will take more time, and the males always very fastly, they premature ejaculation, other problems will come. So we are general practitioners. You are practicing only the sexual disorder. That is a different matter. We see a lot of patients, general practitioner, but the sex is very important in general practice of psychiatry, general psychiatry. So what we do generally is how to make the male to maintain tumescence for a long time, and how to make the female to get more very fast climax. So we train the husbands how to make the wife to get fast climax, and how to maintain his tumescence. So he must be offensive, because testosterone they want to dominate, but they cannot dominate. That is the problem. So they are more offensive, and even females feel that my husband is, is very masculine and doing it. So that is the thing, that most of the time in any other psychiatric problem. So we'll see that how the function is going on, sexual function, whether it's correct or not. And one more point, I'm observing a lot of patients quarreling each other, maybe software engineers, maybe the lifestyle of present lifestyle, quarreling each other, telling negative from the wife and negative from both sides, husband. Generally, when I inquire about the sexual life, they're not meeting at all. So if you improve the sexual life, then they will come out. So usually they will come together. So this is the finding. The sex is very important in general practice. And these are the things, and we are not getting a big problems. Of course, if any resident problem comes, you are there to refer. But generally, these are the principles, and I want your comment on these 2 points. Thank you.
Observe. See, for example, man gets aroused very fast. That doesn't mean that he's a stronger sex. See, evolution-wise, man's job is to sow the oats wherever opportunity available immediately. Now you got the point. But women have been trained to be, in fact, be careful about being choosy and being comfortable. Only then actually permit. Women are a stronger sex. In fact, I can talk for literally 1 hour on this particular topic, but I'll condense it very briefly. See, you look at the sperms. X sperm is a very strong sperm. It can survive for 5 to 7 days. Y sperm is a very weak fellow. Survive for 24 to 48 hours. This is the reason, actually, what I mentioned earlier. 70% of the time, natural pregnancy, it is actually the female. 70% of the time, natural abortions is related to the male sex. That is one. Initially, we thought women are weak because they are highly emotional and a whole lot of things. And now we are well aware they are not exposed to a whole range of systemic disorders, not because of anything, but emotionally they can actually express, and that takes care of them. Men actually don't express, and that is one of the reasons why they land up with a whole range of systemic disorders.
Cardiac.
So what we are trying to document here is the female sex is evolutionary wise. It is, see, the other one, see, man, both urine and reproductive functions have to go through the same passage. In the lower animals, if you try to look at cloaca, in fact, for everything, there is only one actually opening is there. But evolution-wise, woman has actually progressed much farther, and there is a separate track for the, actually for uterus and for urinary bladder. That means evolutionary-wise, women have already progressed. Men are stuck at that particular level. Now you look at it. So this one.
Yeah.
Spiritually speaking, and lot of, see, for example, the woman's strength and other related things, only after marriage we understand all those things. See, we cannot match their intelligence, their way of handling things, and many other things. A successful man is one who listens to wife. No, this is very simple formula. The man who has not succeeded, he has not listened to his wife. That's all the point. Either you should not have wife to succeed, or when wife is there, listen to wife. No, you got the point. You look at Narendra Modi or look at any other person. So you should not marry. Once you are married, just listen to her, what she says. You'll be successful. This is one of the very simple to put it.
Sir, if we leave like this, it will continue, sir. this will continue for long. Any more questions?
And
We would like
but
to.
only one before Dr. Gauri Devi speaks about.
Ma'am wants to ask.
God is also an intelligent fellow. if men have to go through all this menstruation, reproduction, they would have died and disappeared. Because you are strong, all the difficulties have been given to the females.
Yeah, women have more resilience.
Absolutely, of course.
And so that's
Talk about resilience, you talk about many things, and their brain functioning. In fact, you see, men's brain is almost always crooked ways of thinking, means it is actually man's brain.
No, it's a wiring. I mean, you need to accept the wiring of male brain and female brain, either due to hormones or, the Y or X chromosome. I think we need to accept that. I think it's a wonderful presentation. I think what I just want to conclude is that very important aspect. I think I just want to summarize taking questions and also Kishan's point of view into consideration. See, in clinical practice, it's not that straight away, like, TSSR is, sexual therapist, and so they come to him. I mean, they're all what you call tertiary cases. But by and large, most often we do come across, somebody asked about the gay, like, how will you recognize? I did have women coming and saying that, the man comes and lies down, I touch, I stimulate him. He doesn't, he turns other side. He doesn't appreciate. I mean, it's not only the dress or anything. It's not the food or anything, the touch, all those things. I mean, we do come across where the man is in few cases, I found that either schizoid personality or schizophrenia on treatment. I just want to say, we should not miss. What you said, I still appreciate. History. So when both get married, we need to think about the personality. One, is it narcissistic personality and just wants to have it and go? He has a say and go. Or is it that schizoid personalities or any other abnormal personality? OC, yeah. OCPD also I found, not having real, sexual relationship because of their rituals and other things. Second is whether they were on medication. That's very important. They hide the fact and they get married and they are on medication and they don't show interest. That's one thing. Another important thing is, Prasad, I think he must have gone. I don't fully agree with him because we are seeing what you call educated people, girls who come to us and say that they know about sex and they demand. But unfortunately, not all women, educated women, know about sexuality and sex. There are, I think, more than 60% of the people who are literate or semi-literate, who are not doctors, who don't have access to the internet, they do have problem in expressing their sexual desire, their attitudes, and interpersonally relate to the spouse. And very important, as you rightly pointed out, I think the interpersonal relationships are more important. If they don't get along well interpersonally, and the families also do support their own children in their sexual relationship, it will end up in divorce because they always try to, justify their causes. This is another problem which we come across. After the marriage, they justify, they try to say that, as you rightly pointed out, they blame the man. Maybe he is asexual or is impotent. And the men say that the girl is a little more demanding. So I think we need to match their, the emotional as well as the psychological requirement, as sexuality talks about, eroticism, pleasure, and interpersonal relationship. They need to be matched to have what you call proper sexual hygiene. I think with this summarizing what you said and what others ask questions, I would like to summarize and over to Dr. George Reddy. If he is not there, to Pawan.
Madam, thank you, madam. I think, as usual, sir, thank you, Dr. TSSR, sir. I think it was, the audience were houseful, sir. We expected around 100, but I think it was around 150. No more questions, sir, anyway, sir, but just a comment, sir. I think the way you present, sir, I think I've seen so many young lady psychiatrists in this audience, sir. I'm sure it's going to benefit them because the stigma around this problem, I think they will definitely be enriched. And even people like us, might be, we are going to look at this whole problem in a perspective as a natural physiological phenomenon so that we can help the female patients to handle this kind of issues. And thank you, sir. And I think it was and a very educative session. And hope we will again meet you up in the next year, sir, 2023-24. Thank you, sir. And Pawan, over to you. And before that, sir, I think I should really acknowledge that the efforts taken by all of us to gather people to attend the program. And I really thank Vishal on this occasion because he has taken a good amount of effort to help in spreading the message. I thank all the members of the IPS TSB and my colleagues from NIMH and the rehabilitation wing who have joined the program, and the members from the Andhra Pradesh Psychiatric Society, from the Kerala Psychiatric Society, and I've seen members from across the country to attend to Dr. T.S.S. Rao, sir. Sir, thank you, sir. T.S.S. Rao, sir. We hope good luck for your future, sir. Thank you, sir. Over to Pawan.
Sir, thank you, sir. On behalf of IPS TSB, sir, we profusely thank Dr. T.S.S. Rao, sir, for this wonderful session, sir, which was very interactive. And we thank today's chairpersons, Madam Gauri Devi and Dr. Anita Rairala, Madam. And thank you all delegates for participation. We thank Excision Pharma for coming forward to sponsor this. Thank you all. Thank you all once again.
And we thank Anil Martin, as usual, a person with commitment and with precise in his delivering the webinar technically. Anil, thank you. Are you there?
Welcome, sir. Welcome, sir. You're always welcome. Thank you so much.
Yes. And thank you, Mohsin Bhai, for sponsoring this event. Thank you, one and all. And Pawan will close the session. So much for, thank you, TSS Rao, sir. Thank you, Gauri Devi, madam. Thank you, Anita.
Good night. Good night, sir.
Good night,
Thank
Vishal.
you, sir. Thank you so much.
Thanks.